Hello, this is Dr. Wade Brackenberry again, and today I'm going to talk a little bit more in depth about some of the efforts I've been doing in rehabilitating my two knee injuries by non-surgical methods. And so up till now, I have utilized physiotherapy. I actually owned 4 clinics that had in total 70 physiotherapists working for me. So I've had exercise rehabilitation, I've done a lot of exercise under vibration. I've had shockwave therapy, laser therapy, and myofascial needling, all of which have helped quite a bit. But up till now, what has helped probably the most has been a series of PRP injections that were administered in Vietnam into my both knees and essentially completely cured the medial meniscus problem on my right knee and dramatically reduced the lateral meniscus problem on my left knee. But I still have maybe about 25% left of residual morbidity, pain, lack of range of motion on my left knee. And so today I'm going to start administering a very popular and very trendy treatment called peptide therapy. And I have here a peptide blend that they call the Wolverine series. And this is BPC 157 and TB 500. And it's, they call it the Wolverine mix, and the two peptides work by different pathways, essentially to increase the body's own ability to heal itself through producing hormones, especially GH, growth hormone. And so I'm just going to go through briefly today about how I'm going to prepare this and then do a video of injecting it into the subcutaneous area above the injury. So first I have here what's called bacterial static water. And it's basically distilled water with a very small amount of benzene alcohol in it to make it sterile and to keep it sterile even after we've inserted a needle into it. I'm going to inject a little bit of air, and I'm going to remove, about 1.5 cc's of water. The peptides are dry. And in the dry state, they can be shipped and moved, and they don't need to be refrigerated. But once I inject this water into here, then it becomes very, very unstable and very easy to damage and sensitive to light and heat. So I'm going to inject the reconstitution water, theoretically, into the dry peptide powder. And then I'm not going to shake this. I'm just going to very gently move it back and forth and allow it to reconstitute. And it's controversial. There's a lot of controversy whether injecting it at the site of the injury or just injecting it into the subcutaneous fat of your belly has the same effect. But from what I've been watching on YouTube, of people I trust who are good athletes who are trying to use this to overcome athletic injuries, there seems to be a lot of value in injecting it in the tissue just above the injury. Okay, so as you can see, I filled up this very small insulin needle with the 2 peptides, and it's a purple color, kind of a bluish purple color. It looks very futuristic. It looks like something out of a Star Trek movie. And now I'm going to take this very tiny insulin needle and inject the peptide into the subcutaneous area above the lateral meniscus. Almost no pain. And then there's just going to be a little bit of a ball of the peptide that draws up under there. Okay, all done. I'm going to be doing this once a day for the next 30 days. And what I'll do is I'll make a few videos on how that goes and then any improvements that I can anecdotally feel with this treatment. Thank you.